So today's topics at first term. At first, I will talk general information of intestinal parasite. So including among these parasites, I selected 3 species of protozoan parasite. First, Eimeria. Second, Cryptosporidium. Third, Giardia. And then A, B, C, like this. In general information, how to detect and the significance of genetic analysis and the protocols, the same. First, general information of intestinal parasites. Of course, intestinal parasites infecting livestock include so many species, as you know. So, but they still remain a major negative impact on livestock sector, including diarrhea and lethal cause worldwide. Of course, as veterinarians, we must exactly diagnose the parasite. So, but the disease causes economic losses, of course, due to diarrhea and lethal cases. Then, by significant degrading in livestock production. And recently, some of them can infect human and have a potential impact as zoonotic. So, of course, not human medical doctor, we veterinarian must evaluate these potential impact as zoonotic. So, what is important for veterinarians and researchers? So, of course, as veterinarians or researchers, the most important issue can be exact diagnosis and detection as the first step. Why? First, for the causative agent in animals and clinical symptom, of course. Second, for potential pathogenicity causing disease. Of course, the animal does not show yet clinical symptom, but we must detect before showing clinical signs. Third, for potential infection sources to other animals. Of course, infected animals can spread the parasite to other animals or human, even if the animal does not show any symptom. Sometimes prevention this is very important. After showing clinical symptom, we must of course we must treat the animals, but sometimes prevention is very important because lower cost than the treatment of the disease. So we must treat these animals for the control of the infection. Purpose in this talk, we would like to introduce the detection or isolation, of course, easy method for especially protozoa, which is difficult to find by the general protocols and the significance of genetic analysis. But I hope these theories as well as method itself. Of course, I just introduce only 3 species, but these theories can adapt to other parasites. So can be helpful for your job and are effective to understand the detailed prevalence of the parasite in Indonesia. Parasites in cattle. So there are so many species and like this. So I would like to focus on these parasites: Eimeria, Cryptosporidium, and Giardia. Because other parasites, these parasites, can be relatively easily detected. But of course, for example, like this, Bunostoma and Fasciola like this, we can relatively easily detect this parasite. But for example, in Iberia species, it is difficult to identify the species by morphology. Of course, we can identify these are Iberian, but we can say this is Iberia bovis or Twelni, subspherica, and so on. We can say. So that is why very difficult to identify exactly. And Cryptosporidium giardia are sometimes or very often difficult to detect. Finally, giardia. What is intestinal giardiasis? Like this, as you know. These are cysts, and after excitation, trophozoite can proliferate in intestine like this. What is the diagnosis of giardia? Of course, direct smear, sugar flotation method, Gimuza staining, iode staining, anti-giardia antibody, PCR. There are so many. But I recommend the detection of giardia by sugar flotation method. This is, I summarize the diagnosis of giardia. For detection of trophozoite, we must do direct smear because trophozoites were so weak. Trophozoite can survive for a long time after shedding in feces. So we must do a direct smear using fresh feces to detect the trophozoite. But that is why direct smear recommended for trophozoite. But about cyst of giardia, cross fertilization is recommended. But changing cyst form, as I said in previous slide. Like this. These are giardia cysts. We can image giardia cyst like this. But in sucrose solution, high pressure can change the form of the giardia cyst like this. But these are specific to giardia, so we can differentiate giardia cyst in this protocol. Genotype of giardia. Giardia intestinalis, human, dog, cat, livestock, many animals, and other, there are some species. Giardia intestinalis assemblage genotype A1, human, livestock, dog, cat, many animals. A2, human, beaver. B, human, beaver, monkey, dog, cattle. That is why probably A or A1 and B are zoonotic genotype. C, D are specific to dog. E are specific to livestock. But there are some rare cases in human like this. Assemblage genotype E can infect human like this. So I summarize giardia species infection in Indonesia. There are some reports. For example, Irian Jaya, 3%, West Flores, Central like this, and Jakarta, Surabaya, and so on. But these are all samples were from human. So we veterinarian must survey their wild or livestock animals for evaluate the potential sources of infection. Our report, giardia in Japan. Of course, from human, we detect assemblage B. This is zoonotic type. Cattle, in cattle, we detect the giardia as assemblage E. This is specific to livestock type, and so on. But in Japan, some researchers detect assemblage B and A in human and ferret. This is animals. So this infection can be transmitted to human from these animals. But these genotypes were detected by PCR and sequencing. So we must do PCR and sequences for further analysis. Conclusion, to control the protozoan parasites, the important issues are possessing the detection method, improving the detection and sensitivity for the parasite, understanding the prevalence in farms or wild areas, sometimes trying to identify the species or genotypes for evaluation of zoonotic potential and pathogenicity using gene bank database, if possible. 5. Instruction the potential of the parasite to the farm. Okay, thank you very much.